We have a focus on healthcare, and we have been working a lot with different kinds of healthcare organizations. FimLab is one, which is what I'm talking about today, but also Tampere University Hospital. We have worked with the largest pharmacy chain, Yhteistyö Apteekit. And we are currently working also with the city of Helsinki to kind of try to push towards reorganizing the health services around the patient instead of around the organization. A bit about this competition. This is these are the criteria that we were given, and we were kind of thinking about what can we offer to fulfill these criteria. The main idea is to advance the practice of service design. So present new ways of doing things and new contexts that we are applying service design, new kind of collaborations of service design. So my presentation, I will try to kind of focus on these issues in the case. There are many kind of things that I could talk about, but this I hope you will get a clear idea of this point of view. And our entry is kind of, I thought about like what are the key parts. I think it's three. It's highlighting the key constraints provided by the healthcare context. What does it mean to design for the healthcare? Also, we present a method for involving people in designing the Servicescape themselves. We believe that a lot of the design takes place in the physical world, so not just in our minds. So we need to involve the body as well in the design process. And the third one is also service design is quite a new field. So often we have to kind of think about how do we kind of start bonding with the client and in order to make kind of a more strategic partnership, in order to help them approach this customer experience in a more holistically way, not just focusing on one single issue. First, a bit about service design. There are a lot of definitions and different kinds of ways of framing it. And this is based a bit on my own reflection on my own work. Like, what is it actually that I do? I think everything starts with meanings. We are meaning-creating creatures. I think this is one big thing that distances us from other animals. We look at things around us, look at people, we look at the objects, the artifacts, the environments, and we start assigning different meanings to them. If you think about a few thousand years back, there wasn't any artificial light, or at least electric light, and during the nights, people just saw the dark sky with stars in it, and they had no way of conceiving, why are they there, or what does it mean that they are there. But nevertheless, they started building some kind of structure or meaning structure to understand what it is. Is it like a god's battlefield, or is it just holes in a canvas or something like this? So people start assigning meanings even before they understand what it's about. This is kind of in the nature of us. So one of the key starting points in service design is to kind of try to dig into these meanings, try to understand how people make sense of the environment. And when you came into this startup sauna for the first time, you kind of enter the space and you try to make sense of this, what is happening here. Now we have two events here, and the other one is sponsored by Nokia. And people were trying to make sense, like, okay, where should I go? And they took a peek around here and they saw Service Design Achievement of the Year. Maybe it's not this. So people kind of create these, and they start immediately. And our job is to find out what it means. And then match these meanings so that they make sense for the organization, or match the meanings from an organizational point of view, that they make sense for the people. And this, if these two match, they create a good customer experience. So if we look at the healthcare, for example, all these artifacts, website, letter, waiting area have to match. They have to communicate what to do, why are you here, where are you going next. Also, the people have to know where are the people coming from, where are they going after this. when the people exit the service, they have to know, how to advance this. And our job is to align all of this into a holistic or consistent whole. And we often say that service design is channel independent. We use different ways of communicating these meanings. And so which means that we have to collaborate with other designers as well. We work with interior architects, we work with graphic designers, with product designers. We also work with business people to understand how their company should arrange their service offerings, etc. So this is a very long process. It's not something you can do within one project, but it requires a longer partnership with your client organization. So about Servicescapes. What is a Servicescape? This is by Mary Jo Bittner, and she refers it to the immediate physical and social environment surrounding a service experience, transaction, or event. So not just the physical things we can touch, but also what does the space communicate? What does it tell you? How does it? What kind of values does it promote? These are all part of designing a Servicescape. It also, she says that Servicescapes have a huge effect on differentiating your organizations, facilitating the customer or employee goals, and finally influencing the nature of customer experiences. So they are a huge part of services. So when thinking about healthcare, this is often these kind of Servicescapes we see. And these are not kind of arbitrary results. They have a background why we have ended here. And I think Servicescapes are one of the biggest differentiators in healthcare. Always when I work with people in healthcare, these are the most hardworking, motivated, and talented people. It's not, I think, but they have to work in environments that kind of assign them certain kind of roles, and also guide their behaviors towards a certain type. This is how a patient's role goes into when you become sick and you enter a healthcare facility. Your amount of agency goes down. This is partly a big problem within healthcare, is that it's designed based on a delivery model, not as a collaborative model. So all the design decisions most of them are made listening to the healthcare staff. They are the experts. They know what should be done. And when you enter a healthcare facility, often your clothes change. You lose your individuality. You are put to lie down in a bed, and if you start moving from the bed, it might actually create a problem for the healthcare. So the patient is a very narrow term in healthcare. But what I'm arguing is that if you study the patient, you might actually find the key how to design the new healthcare, the much better healthcare. This is how I approach the components of healthcare design. One of the most important things is how it does its job. If we define the job of healthcare as making people healthy, how well does it do it? How well do the measurements they take, how accurate are they? How well does operating theater support the work of a doctor? Then a lot of things is about process. How efficiently are things done? How well do all the environment supports people's interactions? And this is a hot topic today, in today's time especially. But one thing that is often overlooked is the experience. How does the patient experience being in a hospital? How do they feel they can navigate a hospital? How do they understand the information that is given to them? And due to this kind of little agency in patients, this is not very much studied. And I'm not saying that we should design only for experience. I'm saying that by studying this experience, we can also increase performance, and we can also make the processes more efficient. So this is a brief introduction to healthcare. Now I'll go into the case. Fimlab Laboratories is the biggest laboratory chain in Finland. It's rapidly expanding at the moment. They have, actually I had in my slides that they operate in 60 places, but now that I checked, they operate in 90 places. So they are undergoing a heavy expansion into the mid-Finland area. And they have to operate in very different kinds of places. These are built in the 50s or 60s, some of them are in the 80s, and they have also a lot of places that are totally new. For example, they might operate in a new mall. They asked us to design a servicescape for this laboratory, for their laboratories that can be modified according to these very different kinds of places. They want the servicescape to support excellent customer experiences, but at the same time they wanted to reduce the amount of space that they have to use in these hospitals. Often these laboratories are quite vast and they are renting a huge space, and the space is not very efficiently used. So they asked to think about this aspect as well. This is our design process. It's based on the double diamond model. We always start with customer understanding first. We go into the context, we try to dig out those meanings that I talked about and make sense of them and create some kind of structure for understanding them. Often while you do this, you get a lot of ideas as well. But what is important is not to fixate on the ideas too fast. It's just to write them down and try to remember them. Then we start focusing in, creating a kind of a strategy for our design. The kind of key elements, what drives it forward. Then we kind of enter the real traditional design process. So we start, for example, in this case, doing the drawings and how the implementation should be going, and finally we then create go into the implementation of the results. In this case, I worked as a team with our interior architect Kristiina, and this is kind of the way our process goes, that we work as a team and we both work all the time, but the lead kind of shifts when the project advances. So in the start, I have a bigger role in defining, what are the methods that we're going in, what are the questions we're asking, what are the things we are focusing in. When we start prototyping, I'm the one responsible of creating the method for that. And slowly, Kristiina is involved in all of these stages, doing the interviews, meeting the people. But slowly, her role in leading the process grows, and she starts taking the initiative in going towards the implementation, going towards the solutions, and then finally creating or supervising the implementation. A bit more in detail, we started first with defining the customer journey. Then we did some ethnographic observation. We also interviewed people. Then we did a thing called cardboard prototyping. I'll go into this a bit later. Implementation, and then finally scaling up from, we have now one concept. How do we approach the whole customer experience better? So first, we met with the client. We start asking them questions. How does your service start? Where does it start from? And we mapped actually the whole service process, starting from perhaps the doctor who gives them the task of going to a laboratory or prescription or an order. But in this case, because we were thinking about the Servicescape, so we started with this first step of orientation. So when you step into a new space, what happens then? And then we kind of identified all of these steps. This was important for us to understand where do we put our insights and observations into. We needed kind of a structure to understand how the service operates. Then we go into the space. This is the pilot is in Virrat, which is a small space basically in the middle of nowhere. The health center was built in the 60s and it still looks like that, kind of like this spaceship aesthetics. And so we kind of try to sense how the environment is and what kind of things does it communicate, and is it pleasant? Is it nice to sit around waiting for your turn there? We also mapped the artifacts that we saw around. In laboratories you have a lot of these kind of vials, is it I think in English, and needles, and basically they are everywhere. Like this is they were like when you entered the space, it's basically everything you saw was files. But also you had a material gathered from local schools, for example, small drawings kids had done, and the staff did a lot of notifications. This is usual in healthcare environments, that you have these plastered small papers everywhere, and you don't really make sense of that as a customer. Also, we sampled the interactions. This picture is from our later work with this organization. But we went and sat in this chair and, okay, how would this go? And we noticed that you know when you are having your blood taken, the vial is put into this kind of thing that moves it around so it won't clog. And while you're waiting there, you're watching your own blood kind of spin around. It's perhaps not the most pleasant environment. And we gained a lot of these kind of observations. So what to do with these observations? What to do with the ideas that you create? You know, do you start putting them down immediately into a plan? You might do that, but also you might there's a lot of things you don't see. You need to involve the people who actually do the work. There's a lot of tacit, quiet information in the practices they do. So this is some of my work in Aalto University. We did this with Tampere University Hospital, and it's based on this kind of idea that you involve the whole body in the thing of design. So I worked with a set designer to create a cardboard hospital for designing a new hospital spaces. And we workshopped in this for about 1 week, doing different kinds of things, operating theaters, polyclinics, patient wards, and all of this started from the activities. What are we doing in them? And then we can design the environments and all the objects around our activities. And with this, you can draw on all of these objects, you can easily move them around, but then they are also quite durable, so if you have these small boxes, you can stand on the boxes. And we kind of tested all this. How does this work, and how would it work? Some of it worked really well. The others it's quite a heavy method to rent a big space like this for a week. But in this laboratory case, we did a much smaller scale version of this in our gallery space at our studio. We had some of these props with us, so we built a small cardboard laboratory. We put all the touch points, all the points of interaction into this space, and then we invited the people in and we walked with them through this. Okay, this is the orientation phase. You have now entered a new space. What are you looking for? What is your main aim? What is your feeling? And we have all of our insights. We try to present them there. And if you had any preliminary ideas, we did them there. We, for example, drew the waiting turn slip machine, and we tried to, okay, what if this said that? And most of our guesses were kind of off. We improved a lot of them during this workshop, and we redid them. And but some of the ideas, the customers loved them, and they really wanted them implemented. So we looked at the artifacts. What do we find in this thing, and also the interactions? How does the actual sampling take place? I have to say again, when I worked with the nurses there, they do this tens of times a day. They're very efficient in doing the sampling. And somehow within the matter of minutes, it takes about not more than 5 minutes to do a sampling. Within this amount of time, you feel very welcome and you feel taken care of. So I think the people are not the problem. But so we try to kind of design the environment around this so that the patient also feels good. And I'll show the results a bit later. So this was a very nice way of kind of testing your hypothesis and testing your ideas and really quickly iterating on them. So what are the results? We put them into 3 design drivers: functionality, clarity, and ambience. And these are situated around different places of the laboratory. So clarity. First, when you enter the space, you need very clear instructions: where to go, what to do, why are you here, press this. Often in healthcare, you are presented with a lot of information as soon as you arrive, and it basically just confuses you. So in the start, just try to do it as little as possible. Then when you're waiting, you might get a bit more information. What happens next? Take your ID out, for example, because you'll need it. And why are you waiting for 15 minutes? It's to calm your body down. And here also we try to create the space like as relaxing as possible so that people are not stressed and waiting. It's not really nice to have something stuck into your body. But we try to create as nice environment as possible. And then the third one is functionality. Support the operations of the staff as well as possible. So if you do a certain kind of movement tens of times a day, it needs to be ergonomically quite well designed so that the people don't get any problems. All of the insights and ideas we put into a very detailed customer journey. This is just a small part of it. So we wrote all of the signs, what it says in the signs. We gave, for each part, we gave a description and the main goals of this touch point. What do we want to achieve with this touch point? Then after this, we kind of designed the environment around this touch point. How does it look? What are the artifacts that we use there? So this kind of process led the design of the environment, not the kind of whole thing. And based on this, we kind of were able to create the whole kind of Servicescape understanding and bring it forward and start kind of going into the implementation phase. Some of the examples we did. So when you enter the facility, we give you 3 choices. If you're here with the time you have reserved before, you can just wait and you will be called in. If you come straight ordered by the doctor, then you have to take a number. Or if you're bringing in samples, you take a number. So just 3 questions that you answer and you press the number. And while they're waiting, they're giving 3 more advice. Just take your ID card, sit for 10 to 15 minutes, try to kind of relax. And also, one of the things was that we noticed is that when people walk out after the sampling, they are told to press on the wound a bit. But because they have all the jackets they have to carry, they forgot this immediately. Immediately when they stepped out the door, they went like, pshh. And then, often you had the blood on the floor and everything. So we try to kind of design also around this, and this is one part of it. In the sampling area, we turned the patient in a different direction. Often they took the sample from the right arm, and which would turn you towards the table where they have all the sampling equipment, and then you would look at the blood flowing there. So we turned the patient the other way, where they sample from the left arm, which is when they can watch outside the window, or we put this small picture in there with a kind of a nice environment. So they wouldn't have to kind of look into the operation. So we divided the room into kind of 2 parts. The thing that the patient sees and the thing that the staff sees and uses. Also, we did a lot of small improvements, like we put a small gallery in the foyer where the students' drawings can be put so that they are nicely there, that not just plastered somewhere. And also we put a kind of a feedback wall where we try to ask people, well, try to visualize the feedback, that they aren't just put in a box and forgotten, but that they are there. Also, we put a box for personal feedback, that people don't have to put everything visible. So if we think about the original goals I presented, by focusing on experience, you can actually aim for improvements in the process. People are better informed. What do I do now? What do I do next? What is expected of me? Also function. People are more relaxed. The sampling is done better. You don't need to take it many times because of the stress levels might be up. So it's not just about making stuff nice for people, but it's also making things better operable for the organization. Here are a few comments. We went there to gather feedback for about the pilot, so we can improve it for the next parts. And the patient liked it. It was this, in comparison to the old one, these are much calmer, more private, with clean, nice walls around. It's a nice feeling. It's small. It's much smaller than the earlier one, but I wouldn't need it any bigger. This guy with the big jacket said that it's comfortable and it doesn't make me anxious, and he was quite relaxed. It's private. In the old rooms, the sampling took place in a bigger room, so now we divided them into small rooms. And this guy, he liked the best when he saw how well the staff did the actual operation. The staff had to move into much smaller spaces. The environments gained quite a nice feedback from them. It's positively different. It's very calm. And also we divided, some of the tools are now in the sampling space, but we also moved a lot of the tools outside the room that you don't need every day, for example. So she said that, okay, I have to go and pick up this one thing every now and then, but maybe it's just good that I don't sit around the whole day. Generally, like, the staff really was appreciative of the new spaces. So now that we have the basic concept and we have been piloting it, we are scaling up. So we are looking at all the other spaces, and also at this stage we have a possibility of looking what works, what doesn't work, and how should we change this from the Servicescape point of view, but also otherwise. I think the client is really excited about the case because it has provided them a way to understand how to operate a service. Just doing the customer journey kind of really opened their eyes. So now we've basically kind of dealt with the Servicescape aspect, dealt with some of the communication in the space, some of the artifacts, but there's a lot still that we are covering. So the next step in our collaboration is looking into the whole service offering. And especially from the patient's point of view, how can we increase the patient's agency in a way that it doesn't kind of erode the healthcare service? So this is kind of a sneak peek into our next services that we are doing with the organizations. It's about how to provide information to people about their own health that a laboratory can provide in a way that allows them to make better decisions about their own health and kind of start taking more agency about being healthy. At the moment we're working on this. The launch should be early next year. So in this way we're kind of looking more at the more whole part of this organization service offering. And we just started with designing for a Servicescape, and they kind of thought that we are coming in just to design their laboratories. But through this process, they have gained a much better understanding how should they start designing for their whole customer experience. So we are kind of continuing work on this and building kind of from all these other points of view that the customer experience requires. So just a few key takeaways. Healthcare is a very specific context that I think designers should pay more attention to and understand how it functions. Through physical prototyping is a very efficient way of testing your hypothesis, testing your ideas, and gaining kind of more another round of iteration to make them better. And also taking a long view, just try to enter from one angle, but then kind of prove the value of taking the customer experience and give the client some tools also to understand how to start designing for the customer experience. So not just look one project at a time, but kind of build a bigger relationship with the client. So that's it. Thank you very much.